Hello, my name is Viviana Barboza, and this is my advanced physical assessment exam. I have my patient RR here who has given consent to be in this video. RR is a 36-year-old male. He has no known drug allergies. He is not currently taking any medications. He has no medical problems. Surgical history includes laparoscopic appendectomy and a laparoscopic cholecystectomy. He has not been diagnosed with any psychiatric illnesses. He is only aware of family history, including hypertension on his mother's side and diabetes on his father's side, going back 3 generations. He is currently married with no children and works at Universal Studios, and I will now begin my physical assessment. Hello, my name is Viviana Barboza, and I will be your provider today. How are you feeling today?
I'm doing well, thank you.
Good. What brings you in today?
Physical.
Okay, so I will be performing your head-to-toe physical assessment. It is important that you tell me if you have any pain or discomfort at all during this exam. Okay? As I enter a room, I will perform my hand hygiene. I will also ensure that there is adequate lighting, as well as the general appearance of my patient. He is in good posture. He is dressed appropriately for the weather outside today, and good hygiene. His vital signs have already been taken. Blood pressure, heart rate, respiratory rate, temperature, and pulse ox were all within normal limits. His height and weight were also measured, and BMI as well, which was appropriate for his age. So first I'm going to assess hair, skin, and nails. So I'm just looking at your skin. I'm also going to look at the skin down your arms. I'm going to check for skin turgor, so your skin is elastic and moist. I'm just going to pull your pant legs up to assess the skin of your lower extremities. And I'm just looking for any rashes or lesions, which I do not see. I do see some moles. Next, I'm going to look at the hair distribution, which is even, and there appears to be no thinning of hair. Next, I'm going to look at your nails. I'm looking at the shape and contour of your nail beds. I'm going to assess for capillary refill, which is less than 3 seconds, and there is no clubbing present. Next, I'm going to do head and face. So I'm going to palpate your scalp. Let me know if you have any pain. And here I'm just looking for any bumps or lesions. Now I'm going to palpate your neck, okay?
Okay.
Again, I'm looking for any lumps or bulging. Do you have any pain?
No.
Good. Now I'm going to palpate the thyroid. If you can look up just a tad bit, good. And again, I'm looking for any bumps or masses that I may feel, which I do not. Next, I'm going to look at facial symmetry and any lesions or rashes on the face. Next, I'm going to do an assessment of your eyes, your ears, your nose, and your mouth, okay? So with my ophthalmoscope, I'm going to look into your eyes, but first I'm going to pull down on your lids, and I'm looking at the conjunctiva, which is pink. The sclera is white as well. The iris is visible, as well as the pupils, which are round and symmetrical. I'm also observing for any drooping of the eyelids, which I do not see. Next, I will use my ophthalmoscope to look into your eye. I will get fairly close to your face, okay?
Okay.
So go ahead and look straight for me. And here I am assessing the fundus, the optic disc, as well as red reflex, okay?
Okay.
So now to the other side. Sorry if it's bright.
No problem.
Good. So next is going to be the ears. So I'm going to palpate, and I'm just palpating for any bumps or lesions as well. And I'm feeling your tragus and your epina as well. I'm going to look into your ear canal now. You'll feel a little tickle with this. I'm going to pull your ear up and back, okay?
Okay.
And I'm looking at your tympanic membrane and any other visible landmarks that I may see, as well as the canal as I enter, so up and back. Tympanic membrane is pearly and gray with no bulging or perforation noted, actually. Next, I'm going to look at your nose. I will flash the light into your nostrils. If you can extend your head back for me. Good, and I'm looking for any nasal septal deviation. Nasal mucosa is pink and moist. No erythema present. And then if you can open your mouth for me. Open nice and big, say ah. Good. So tongue is symmetrical, uvula is midline, tonsils are 1+ with no erythema present. Next, I'm going to assess your cranial nerves. I will let you know which cranial nerves are intact, and they will be easy commands that you will follow. If you need me to explain any of them, I can, and I will try to do them with you so you can understand what I'm asking.
Okay.
So the visual acuity test was already performed before you entered the room. And now I would like for you to look straight ahead for me, and I'm going to flash a light into your eyes, and I'm just making sure that there is pupil response, both direct and consensual, okay?
Okay.
So go ahead and look straight for me. So pupils are reactive to direct light. Now I'm going to do it again. And pupils are reactive to consensual light. Now if you can please follow my pen with just your eyes. Try not to move your head. Okay? And go ahead and look at my pen light, or my pen, and now look to the clock behind me on the wall. Good, so pupils are reactive to both direct and consensual light, as well as accommodation and convergence. So cranial nerves 2, 3, 4, and 6 are intact. Next, I'm going to palpate your mastoid. Go ahead and clench your teeth for me. Good. Go ahead and smile. Now frown. Puff out your cheeks. Good. Now close your eyes. Tight, tight, tight. Good. Now go ahead and relax that. Keep your eyes closed. I'm going to just touch your face with a soft Q-tip. Just let me know when you feel the touch, okay?
No. 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 No.
Good. Go ahead and open your eyes. So that's cranial nerves 5 and 7 intact. Next, I'm going to perform a hearing test. So I will strike, this is a tuning fork. I will strike the tuning fork. I will place it on your head, and you will let me know when you, if you hear the sound equal in both ears, or if you hear it louder in one ear more than the other.
Okay.
Okay? Did you hear it equal in both ears, or?
Yes.
Okay. Next, I'm going to do, that was the Weber's test. Next, I will perform the Rhine test, which will, I will strike the tuning fork, place it on your mastoid, which I had palpated earlier. You will tell me when you no longer hear that sound. After that, I will then move the tuning fork in front of your ear, and again, you will tell me when you no longer hear the sound, and that's to test bone and air conduction, okay?
Okay. No. Good.
Now, okay. Now I'm going to do the other side as well, okay? So again, I'm going to place it here. Let me know when you no longer hear it. Then I will move it to in front of your ear. Let me know when you no longer hear it.
Okay. Okay. No.
Okay. So cranial nerve 8 is intact. Next, if you can stick out your tongue for me, straight out, and move it side to side. Good. Go ahead and swallow for me. Good. The gag reflex was already done prior to you entering the room, so cranial nerves 9, 10, and 12 are intact. Next, I'm going to place my hands on your shoulders. Go ahead and shrug up. Good. Move your head to the left against my hand. Good. And now to the right. Good. So cranial cranial nerve 11 is intact, okay? Next, I'm going to move on to chest and lungs. So first, I'm going to inspect the chest for symmetry. Now I'm going to listen to your lung sounds. For the purpose of this video, I will just place my stethoscope where I would listen. I would listen for a full inspiration and expiration of the patient. But like I said, for the purpose of this video, I will just place the stethoscope where I would listen. Next, I'm going to ask you to turn to face the wall, please. Yes. Are you comfortable there?
Yes.
Okay, so again, as I am moving from the anterior portion to the posterior portion, I'm looking at the AP diameter, which is 2 to 1, which is normal. Again, for the purpose of this video, I will just show where I would place the stethoscope as I would listen with the diaphragm. And I would listen, like I said, for a full inspiration and expiration of lung sounds. And lung sounds were clear upon auscultation. Next, I'm going to assess for tactile fremitus. So when you feel my hands placed on your back, please say the number 99.
Okay. 99, 99, 99, 99.
Good. Next, I'm going to assess for respiratory excursion. So I will place my hands around your ribs, and I will then ask you to take a full deep breath in and out, okay?
Okay.
Okay, go ahead. Good. Respiratory excursion was about 4 centimeters, which is normal. Next, I'm going to assess for the diaphragmatic excursion. I will explain to you when I need you to hold your breath. When I say the word relax, you can go ahead and let go of that hold. And I will be doing that 2 times, and you'll feel me putting slight pressure in the back, okay?
Okay.
So go ahead and you're going to take a deep breath in and exhale and then hold it.
Okay.
Okay, hold. And I am assessing for dull sounds. Okay, relax. And I'm going to make a mental mark and note of where I found it. Next, I'm going to ask you to take a deep breath in and hold.
Okay.
When you're ready. Okay, relax. Good. So diaphragmatic excursion was about 4 centimeters, which is normal. Next, I'm going to ask you to turn to the front again, and I will be doing a cardiovascular assessment, where I will be listening to your heart sounds, okay? So with the diaphragm, I will be going to the aortic valve, which is right sternal border, second intercostal space. Then I will do pulmonic, which is left sternal border, second intercostal space. Then we'll go down to the Erb's point, which is left sternal border, third intercostal space. Then we will go down to pulmonic valve, which is left sternal border, fourth intercostal space. And then the tricuspid, which is left intercostal border, left sternal border, fifth intercostal space. Okay?
Okay.
I would do that with my diaphragm in each 5 spots, and then I would flip to the bell. And again, I would listen to those same 5 exact spots with the bell of the stethoscope, and that is to listen for any heart murmurs, which I did not hear. Next, I'm going to assess for the PMI, which will be mid-clavicular of the left sternum, and I will come down to about 5th intercostal space, and I will feel for the point of maximum impulse, which I can feel. Next, I'm going to listen to your carotid arteries up here, and I'm just listening for any bruits, okay?
Okay.
And I'm listening with the bell of the stethoscope, which I do not hear. If you can lay back about 45 degrees and hold yourself there, just like that, where my hand is. Turn your head to the left, slide back more. And now to the right. Turn. And I am just assessing, you can sit up now. I'm just assessing for jugular venous pressure, okay? Or pulsation, sorry. Next, I'm going to move on to the abdomen portion of the assessment. So if you can lay back. I'm just going to raise your shirt up to see your abdomen area, okay? So first I'm going to inspect. I can already see the scars from the laparoscopic appendectomy and the cholecystectomy. After I inspect, I'm going to auscultate with my stethoscope in all 4 quadrants, okay, with the diaphragm of my stethoscope. Typically, I would listen for at least a minute in all 4 quadrants to ensure that there are either normal, hyperactive, or hypoactive bowel sounds. While I am here, I'm also going to listen to the arteries in this area with the bell of the diaphragm. So I will listen to the aortic artery, the renal arteries, the iliac arteries, and the femoral arteries as well. And again, I'm just assessing for any, or listening for any bruits in those arteries. While I am here, I'm going to do some light palpation in all 4 quadrants, and this is just to ensure that there aren't any masses in your abdomen, okay?
Okay.
Please let me know if you have any pain at all during this time. Any pain?
No.
Good. While I have you here, I'm going to assess for the aortic pulsation. So I'm going to go to your mid-upper abdomen. I'm going to go slightly to the left, and I'm just going to put some deep pressure to assess for the aortic pulsation, which I do feel. Next, I'm going to palpate the liver. So I'm going to place my left hand under your 12th ribs around there. And then with this hand, I'm going to apply some pressure under your costal margin. And I'm going to go up and down as I feel for the liver while you take a nice deep breath. So you will feel some pressure, okay?
Okay.
Go ahead and take a nice deep breath in and out. Good. So liver edges are soft. Next, I'm going to palpate for your spleen. So I'm going to reach across you with my left hand under your 12th rib area, and I will use my right hand to go under your left costal margin, and I will palpate for the spleen, okay?
Okay.
So again, take a nice deep breath in. Good. So tip of the spleen is palpable. Next, I'm going to palpate for your kidneys. Typically, these aren't palpable. If they are, that usually means an enlarged kidneys. So if I don't feel them, that's a good sign. So go ahead. I'm going to lift up with my right. You relax. I'm going to lift up with my right and put some pressure with my, no, I'm going to lift up with my left hand and apply some pressure with my right hand. Do you have any pain?
No.
And again to this side. Okay, so kidneys were non-palpable. Next, for the purpose of this video, he has had his appendix removed, but I will still perform the test to assess for appendicitis. So the first one is Murphy's sign. So I'm going to ask you to take a deep breath. I'm going to go under your right costal margin and apply some pressure. Please let me know if you have any pain at all. Okay, so go ahead and take a nice deep breath in. Do you have any pain?
No.
Okay. Next is going to be the obturator sign. So go ahead and I'm going to, yeah, we can lower your shirt now. Thank you. I'm going to flex your knee just like this, and I'm going to internally rotate it towards the width of the hip. Let me know if you have any pain at all. Do you have any pain?
No.
Okay. Go ahead and relax. Now we're going to do the psoas sign. I want you to raise your right leg to resist against my hand. Go ahead. Good. Did you have any pain?
No.
Good. So those were negative for appendicitis. Next, I'm going to, you can go ahead and sit up. You can go ahead and sit up. Next will be a cerebellar function test. I would first do a genitalia exam, but that has been deferred for the purpose of this video. So, actually, I'm going to ask you to sit on this side of the bed. Good. So I want you to stretch your arm out all the way as far as you can. Now go ahead and touch your nose. Now touch my finger. Good. Now with your hands in front of you, just like that, I want you to alternate them back and forth as fast as you can. Good. Now with your right leg, I would like for you to run down your left from the knee down to the shin, please. Good. Now to the other leg as well. Good. Now if you can stand up for me, please, and turn face that way. I'm going to perform a Romberg's test. If you can close your eyes, I will have my hands wrapped around you. And go ahead and close your eyes, and I'm just testing for your balance, okay? Good. You can go ahead and open your eyes. Now, if you can stand back for me here and walk across with a normal gait, just to the edge of the bed. Good. Now, turn around and walk on your heels. Good. Now, turn around, walk on your front toes, your tippy toes. Good. Now walk back with your heel in front of your shin like this. Yes, perfect. That's good. And now if you can walk with your knees bent like a duck, now walk across. Good, that's perfect. Thank you. Now you can have a seat here. Next you can have a seat. Next I'm going to test for sensation. So this will be my, so if you feel this will be like a soft sensation, and this will be sharp sensation, okay? I will be doing that to your upper extremities and your lower extremities with your eyes closed, okay? So go ahead and close them.
Sharp. Soft. Sharp.
Good. Close your eyes.
Soft. Sharp.
Now the other leg.
Sharp. Soft.
Good. I do need to check the capillary refill of your toes. If you can please take off your socks. Good. Cap refill is less than 3 seconds. I will now assess for sensation by using this tuning fork. I will place it to your big toe and just let me know that you feel the vibration, okay?
Yes.
Okay? And I will do it to I would also do it to the other big toe as well, and you can go ahead and put your sock back on. Thank you. And I will place it here. Let me know if you feel the vibration, okay?
Yes.
Okay, and other side?
Yes.
Good. Next, I'm going to check your reflexes, okay? So go ahead and relax your hand. Okay, good. Relax your hand here. And relax your hand up. Okay, so biceps, triceps, and brachioradial reflexes are intact. I will also do it to this side. Good, and relax your arm up for me. Good. Next, I will check for the patellar reflex. Slight movement there. Good. Now, if you can raise either leg, either foot onto the knee. And I'm going to check for the a little slightly out more, so it's kind of hanging. Yes. Now I'm going to check for the Achilles tendon reflex. Good. Now the other leg. Thank you. We'll try like this. Good. Go ahead and lower them. And now I'm going to check for the Babinski reflex or the plantar reflex, okay? Now the other one. Relax your foot. Good. So response was normal. Next, I'm going to assess your major joints. So I will do the neck, shoulders, elbows, and wrists and hands first, okay?
Okay.
So I'm just palpating the neck. If you can rotate your neck around, good. Shoulders, if you can raise them high above your head, your hands, good. Try and separate my hands, good. Now, I'm going to try and open your arms. Try not to break it, okay? Good. You can bring them down. With your hands, if you can flex them up and down at the knee, at the elbows, good. Any pain?
No.
Okay. Put your arms like this and try and pull up. And now push against my hands. Good. Now at your wrists and your hands, go ahead and rotate them outward. Now inward. And open and close, make a fist. Good. Do you have any pain there?
No.
Good. So neck, shoulders, elbows, wrists, and hands all have full range of motion and strength 5 out of 5. I will ask you to stand. Go ahead and bend forward. I'm going to check the curvature of your spine all the way down as far as you can. Good. So spine is straight. Go ahead and stand up. No curvature. Bend back as far as you can. Good. Any pain at your hips?
No.
Okay, go to your right side, bend over. Now to your left. Good. Thank you. You can have a seat. Next, I'm going to check your knee joints. If you can pull up against my hands, good. And pull down, good. Now I'm going to check your ankle joints and your feet joints. Rotate them out for me and rotate them in. Good. Any pain?
No.
Okay, so hips, knees, ankles, and toes all have full range of motion, strength 5 out of 5. Next, I'm going to ask you to lay on your back. Now I'm going to do what's called a McMurray's test, where I will be assessing for the for any meniscus injuries.
Okay.
So you're going to go ahead and relax your foot, fully extend it, and I'm going to externally rotate it. Do you have any pain there?
No.
Good. I'm going to internally rotate it now. No pain? Good. So that's just assessing for your lateral and medial meniscus. Next will be the, I'll do the other side. Okay. I'm going to rotate it in and rotate out. Do you have any pain?
No.
Good. So that is, there's no sign of a meniscus tear there. Next, I'm going to check your varus and valgus stress test, which are ligaments. So if you experience any pain, that would be sign of a ligament tear. So you're going to fully extend your leg down, relax it, and I'm going to apply varus stress. Do you feel any pain there?
No, I do not.
Okay. And now I'm going to apply valgus stress. Do you feel any pain there?
No.
Good. I'm going to do it to this side as well. Fully extend your leg. Do you feel any pain as I apply varus and valgus stress?
No.
Okay, so that is negative for any ligament tear or injury. Next is the anterior drawer test. If you can bend at your knee, pull your leg up. Yes. Closer to that side. Typically, I would sit in front of the patient to prevent it from going back, but I'm going to apply anterior pressure to the crucial ligaments. Do you have any pain?
No.
Good. Lower your leg. Now do the other side. Do you have any pain there?
No, I do not.
Okay, good. Next, I'm going to ask you to slide your body towards the edge of this bed just so I can do the shoulder apprehension test. No, you're still going to lay down? Yeah, and have your, just like that. Perfect. I'm going to extend your hand like this, and I'm going to hold it at the humerus and apply downward pressure at your hand. Please let me know if you have any pain in your shoulder. Do you have any pain?
No.
Good. I would also do that to the other side. Next, I will ask you to stand in front of the bed here for me. Go ahead and face the wall. Next, I will be performing the Apley scratch test. So with your right hand, I'm going to ask you to go over your head and back and reach for your left scapula as far back as you can. Good. Now do it with your other hand. Good. Now back down, and now we're going to reach behind your back and upwards all the way to your left scapula. Good. And now to the other side. Good. And these are checking for rotator cuff tears. Go ahead and turn around. Next, we're going to do the empty can test. So go ahead and put your hands straight out. Point your thumbs downward and resist my downward pressure. Good. So no weakness, so there's no rotator cuff tear. Next is going to be the arm drop test. So you're going to raise your hands to shoulder level and slowly drop them to your sides. Good. So that is negative for a rotator cuff tear. Next, we're going to assess for the Tinel's test. So I'm going to place like a pulsing pressure onto your median nerve. Do you have any pain, numbness, or tingling in your hands?
No.
I will do it to the other side, and this is to assess for carpal tunnel syndrome. If you had pain, numbness, or tingling, that would be an indicator of carpal tunnel syndrome. Now I'm going to ask you to flex your wrists just like this. Good. And typically I would ask them to hold this for 60 seconds. You can go ahead and let go. Did you have any pain, numbness, or tingling?
No.
Good. So that is, if you did, that would be an indicator of carpal tunnel syndrome, which you do not. You can go ahead and have a seat, and that concludes the advanced physical head-to-toe assessment. Thank you.